All right, we're here with Jim. Thank you for joining us here. We're in Nashville for the AAPCP conference.
Thanks for having me, Eric.
Excellent. One of the questions I've been asking everyone, how did you get into physician compensation?
Yes, so initially my background is in broad-based HR compensation. And our health system went through a pretty significant merger like many other healthcare systems across the country over the past decade. And we were tasked with integration efforts in terms of compensation plan design for our broader employee base. However, in the physician space, that was rather decentralized and managed by local department level leadership. And so you can imagine the disparities that existed within physician contracts. And they really didn't have a central department to manage that. So we were tapped on the shoulder after going through that harmonization exercise for the broader employee base to be kind of a neutral party to manage provider compensation and to better align the plan design with our health system integration efforts. So we just kind of got tapped on the shoulder with no experience, right? Partner with a consultant and figure it out about 10 years ago.
Excellent. So kind of asked to do it, stepped up, a little self-taught there, and learned on the fly.
Yeah.
What a cool story. What does your family think you do? You come home from a long day of work. What is their image of what your day-to-day work is like?
Yeah, quite frankly, I don't think they'll ever understand what I do, but I think in a nutshell, they probably think I manage how a physician is paid, which certainly is part of our job, but as you can imagine, the multidisciplinary nature of it is much more complex and broader than that, considering that a lot of our incentive plans are directly supportive of our operational strategy.
Excellent. We talked previously, you were talking about expanding your team, getting the right resources. What is one initiative for your team that you're focused on for the next 12 months?
Yeah. So I think, beyond the day-to-day and, even the technical aspects of the role with plan design and development, provider engagement is something, it's an initiative that we're partnering very closely with our chief medical officer on. We've designed some pretty sophisticated compensation plans with great intent to realize value, but oftentimes that falls short at execution. And one of the reasons that we're noticing, mainly through employee engagement surveys, really, so we picked up on this, is one of the gaps we have is how this is conveyed from the frontline and middle management leadership to the physicians. There seems to be kind of a disconnect between, the development side from the executive team and then how that is eventually translated to the physician themselves. So we're trying to be more intentional about how can we take a train-the-trainer approach, right, to provide the right educational tools and resources to both our physician leaders and their dyad partners, the chief administrative officers, to be more effective in really helping the physician understand not just what they're being paid, but why they're being paid, what they're being paid, and what opportunities exist for them to partner with us to really improve care for the community.
That is great. A lot of it is sometimes relationships can be a little bit fractured or tense. So love the fact that you're out there reaching out and driving engagement throughout the organization there. Yeah. Is there an area that you've seen that's kind of bubbled up in the last 6 months that's maybe causing a little heartburn for you and your team there?
Yeah, I would say anesthesia services. Hospital-based arrangements are probably top of mind just due to the demand, right, and the shortage of supply. And so one of the unique things that our health system is pursuing is we are partnering with a local school in the area, right, to develop a pipeline for talent, starting a new CRNA program, to ensure that we don't fall behind, in terms of the staffing that we have in place for anesthesia, because you know that has a ripple effect to many other surgical services that we provide. But yeah, that's an area that we're still questioning, how to make that more sustainable within our health system.
That's a really cool point, that it's not just leveraging CRNAs for that service line, it's also training the future CRNAs
That's right.
to do that. That's pretty innovative. This was great insights. I appreciate your time. I appreciate you sharing what's going on in Rochester there. So
Yeah,
we'll
thanks.
let you get back to the conference, and thank
Great.
you.
Thanks, Eric. Appreciate it.